Okay, hello. What we're going to be doing right now is we're going to be going over articulation, how you would address that, and of course that's a behavioral type of treatment. The thing with Parkinson's patients is that they have a slurred quality to their voice. It's slurred or a mushy sound, not a lot of crisp articulation. So one of the ways to address that is by addressing their rate and rhythm. You want to slow it down. So it gives their articulators more time to reach the proper positions. So one of the first ways we're going to address that is by using a pacing board. Now typically a pacing board will be somewhat like this shape, and it'll have slots for the fingers, and you will have them place a finger in each slot as they say a syllable. We have something that's similar to a pacing board in terms of its function, and basically that is they will place their finger on a spot every time there's a syllable. Okay, so I'm working with the client, and so I'm going to give her a list of words that I want her to say that are multisyllabic, and she's going to tap her finger along as she says them. Okay, Morgan, I'm going to have you say the word farmer.
Farmer.
Excellent. Let's say the word feather.
Feather.
Let's say the word fireplace.
Fireplace.
Great. Okay, so what she did is she tapped her fingers out per each syllable, and that slowed her down. Another method of slowing the rate would be an alphabet board. And so what you're going to do is you're going to have all the letters of the alphabet printed out, and you're going to basically have them spell the word as they say the sound. So an example would be to have them say the word bee. So they'd be b-e, something like that, okay? So I'm going to have Morgan go through and do a similar thing with the same words, but tap them out in a way that she's spelling them. Okay, Morgan, I'm going to have you say the word face.
Ace.
Excellent. I'm going to have you say the word feet.
Eat.
Good. So what you guys didn't see is that for feet she went f-e-t. Okay? So that's another method of slowing down. Okay. Two things that we don't have but you can also use for reducing the rate and rhythm would be a delayed auditory feedback system, which is when you wear something in your ear that basically feeds your voice back to you on a delay, so a second or two later. And that's shown to improve rate and rhythm by slowing it down because your brain is processing what you're saying afterwards, so naturally it slows your rate. The last method that we're going to demonstrate is reciting syllables to a metronome. And you can set the speed of a metronome to be slower in terms of its movement. And so every time it goes back and forth, you would say a syllable, such as face, farmer. Okay? So we have a metronome installed on the phone. It's an app. Okay? And it's moving back and forth. And so what Morgan's going to do is say the syllable of the word each time it moves from side to side. Okay. So Morgan, what I want you to do now is I want you to repeat these words after me. But every time we hit a syllable, I want it to be when this swings from from one side to the other.
Okay.
Okay? Let's say the word finger.
Finger.
Excellent. Let's say the word football.
Football.
Good. Let's say the word breakfast.
Breakfast.
Excellent. One more word. Let's say the word vegetable.
Vegetable.
Excellent. As you may have noticed, the word that she said was substantially slower because she had to wait for the metronome to reach each side in order to say the syllable. Okay, what we're going to do next is still along the lines of treating articulation, but this time we're going to be stretching the articulators. There's passive and active stretching. Passive stretching is where I will stretch the articulators for the client gently, of course, and then active stretching is where I'm going to have Morgan stretch the articulators herself. Okay, so first what we're going to do is we're going to do some lip stretches. So you always want to wear gloves and have a piece of gauze. And what we're going to do is you will pull the lips.
Oh, sorry, it's okay.
You will pull the lips gently forward. Okay? So you'll pull the bottom lip and then you'll pull the top lip. Good. Okay, and you'll push them to the corners. Excellent. And then you'll purse them. Great. So what you want to do is you want to gently pull the lips and hold them for about 5 to 10 seconds and then slowly release. This is going to be the same for the tongue. Okay? So I'm going to pull her tongue out a little, hold it gently for a few seconds, and put it back in. Okay? And then I'm going to do the same thing and go from side to side. Gently pull it from side to side. Okay? So that's the gist of it. Obviously, you would go slower and you would make sure to keep it gentle for the patient. You would do the same thing with the jaw, where you would push their jaw from side to side. So you would push it this way, and then you'd push it this way. Okay? And then active stretching would be where I would tell Morgan, okay, Morgan, I'm going to have you pucker your lips and try to hold them. Excellent. Okay, now I'm going to have you smile. Good. Okay, and same thing for the tongue. You're going to ask the patient to protrude the tongue or stick out their tongue. Good. Okay, and now I'm going to have you put your tongue side to side, stretch it side to side. Great. So obviously she has great, she's able to do that, no problem. And then same thing with the jaw. You're going to have the patient hold their jaw from side to side. Okay, Morgan, so I'm going to have you push your jaw to the side. Great. Great. Very good. Yeah, that's kind of hard. So you imagine your patients, it would be kind of difficult. And of course, then there's traditional approaches to articulation treatment, which would be your intelligibility drills, phonetic placement, exaggerated consonants, and minimal contrast drills. So to start off with intelligibility drills, what you're going to do is you're going to have the patient read a list of words facing away from you so that all you have to go on is how the words sound. So I'm going to have Morgan read this list of words without me looking at it. So I will have to just go based on my ear. Okay, so what I'm going to have you do is I'm going to have you read through this list of words, but I'm going to face away so that my ears have to be what I rely on to understand, okay? Mm-hmm. All right, so I'll let you know when I'm ready, okay? And I'm going to, okay, so let's go.
Face, fan, farmer, faucet, feather, feet, fence, ferret, fiddle, fig, fin, finger, fireplace, fish, food, football, fork, fox.
Excellent. Okay, so obviously she was completely understandable. But what you would do is you would mark down words that you weren't able to understand, and you would go back and you would look at where they were and you would move forward from there. In terms of phonetic placement, you would basically talk about where the articulators would move for that sound. So we're going to use the T sound as an example because visually it's easy. And I would explain to her where the tongue belongs and how the lips are formed in order to produce that sound. So it would go something like this. Okay, Morgan, in order to produce a clear T sound, I want you to put the tip of your tongue on the bumpy part up behind your teeth, okay. Called the alveolar ridge. Mm-hmm. And your lips will be slightly apart, and you will add your voice as you tap your tongue. Okay, so mm-hmm. T, t. Excellent. So that's articulatory placement, which is where you basically tell them where their articulators would belong. For exaggerated consonants, what you would do is you would have them over-articulate. So I would have her say a certain word more crisply than she would normally say it. So for example, as we've been using this list, we'll have her say the word fan by emphasizing all the sounds in that word. Okay, so what I want you to do now is we're going to say common words that you've heard before, mm-hmm. but I want you to really emphasize each sound in the word. Say it more sharply than you normally would, okay? So for fan, I want you to say fan.
Okay. Fan.
Good. Fan.
Fan.
Excellent. So that would be exaggerated consonants. You would have them really focus on over-articulation. For minimal contrast drills, you would choose pairs of words that differ by one phoneme. So you would choose the words such as peg and bag, rude and food, okay? So it would look something like this. Okay, I'm going to have you say sets of words that differ by one sound, okay? Mm-hmm. And I want you to say them as crisply as you can. Food, rude.
Food, rude.
Dog, fog.
Dog, fog.
Good. Okay, so that's pretty much how that would work. And that concludes the articulation portion. So it's focused on rate reduction, it's focused on stretching, both passive and active, as well as the traditional articulation drills. Thank you.